Hello, my name is Courtney Stewart, and I am a DNP student here at Western, and this is my capstone project. The goal of this project is to improve nurses' knowledge regarding type 2 diabetes, self-care management education. The prevalence of type 2 diabetes. 422 million people worldwide have type 1 and type 2 diabetes. It is the seventh leading cause of death in the U.S. 37.3 million adults have a diagnosis of type 2 diabetes. Kentucky is ranked 8th nationally in type 2 diabetes prevalence, and 11% of Warren County population has a diagnosis of type 2 diabetes. Some background information: risk factors for type 2 diabetes: increasing age over the age of 35 and a positive family history, BMI greater than 25, ethnicity African American, American Indian, Asian American, Hispanic, Latino, and Pacific Islander, lower income, lower high school graduation rates, more single parent households, and crowded housing all have an increased risk for type 2 diabetes. Complications include cardiovascular disease, stroke, kidney disease, blindness, and lower limb amputation. And with those complications, there is increased cost. It is estimated to be 2 to 8 times higher than any other chronic condition, 2.5 times higher cost of hospital inpatient stays, 3.4 times higher prescription medications, and 1.9 times higher office visits. The cost has also increased over the last 10 years. In 2007, it cost healthcare $116 billion. And then in 2017, it increased to $237 billion. The cost per person is estimated to be $16,752. Like I said, this is my capstone project, and the goal is to improve nurses' knowledge and therefore improve our patients with type 2 diabetes knowledge. The primary function of a bedside nurse is diabetic education, which has proven to prevent readmissions and improve quality of life. However, there is a gap in the type and focus of the education. So I have found 5 self-care management skills that has proven to improve the management of diabetes. And so that includes their general diet, their specific diet, exercise, blood glucose testing, and foot care. It's improved hemoglobin A1C, blood pressure, cholesterol, medication adherence, limit diabetic complications, which decrease hospital readmission and decrease overall cost. So the first skill is the general diet, which is also called the plate method. And this is for anyone that consumes food. So half of the plate should be consumed with a non-starchy vegetable, which is basically anything from the ground: your salad, green beans, broccoli, cauliflower, cabbage, and carrots or tomatoes. 1/4 of the other half is a protein. They specifically say a lean protein, so a chicken, turkey, bean, or egg. And then the other 1/4 of the half should be consumed with your carbs, which is your grains, your rice, your pasta. You can also add in a starchy vegetable such as a potato. And then if you like milk, your milk can count as a carb as well. And we have our specific diet, which is the second skill. All diabetic patients should know how to count their carbs, and that also helps track their meals, track how much medications they take, especially for patients who are on insulin. There's three types of carbs: your sugars, your starches, and fiber. Sugars, you have natural and added. Starches, you have your wheat, your oats, potatoes, beans, and then fiber, which is your plant foods that aren't digested, and they also don't increase your blood glucose. So in order to count your carbs, you have to know how to read a food label. And I'm just going to point out a couple things that we should point out to our patients so that they know how to read and count their carbs. So you should first look at their serving size. So for this serving size, it's 2/3 per cup, 2/3 of a cup. And the package has 8 servings. You have a total carbohydrate of 37 grams, which is divided into your fiber and sugars. You have 4 grams of fiber and 12 grams of total sugar with 10 grams of added sugar. And then I'll go through the next slide about how to calculate the amount of carbs. So choosing baked chicken, Swiss cheese, and peanut butter over a baked potato is part of making that healthy choice. Additionally, knowing that when you read a food label, free foods such as fat-free or sugar-free is also not necessarily quote-unquote healthy. So here's an example. So you have 6 ounces of a chicken breast, which is 0 grams of carbs. A cup of brown rice, which is 45 grams of carbs. 1 cup of steamed broccoli, which is 12 grams. So 45 plus 12 is 57. And then you divide that by 15, which gives you 3.8, and you round it to 4 carbs per serving. And then, so for that meal, you have 4 carbs. And most diabetic patients, if they're on insulin, they will calculate how much insulin to give themselves based on what they, how much they eat for that meal. The third skill is practicing safe exercise. The most important thing for a diabetic to do before exercising is to check their blood sugar. If it's less than 100, they should probably eat a small snack. It's recommended to do 15 to 30 grams of carbs, which is about 2 tablespoons of raisins or half a cup of fruit juice. If it's over 240, they should not exercise and probably check their urine for ketones. The presence of ketones indicates that your body doesn't have enough insulin. And if they are physically active with high ketone levels, it can cause the body to go into ketoacidosis, which is a serious complication, and it most likely will need hospitalization. And then the second thing they should do is bring a snack, carry identification, and wear appropriate shoes. The CDC recommends 150 minutes a week of activity, consisting of basically anything that the patient enjoys: walking, dancing, gardening, anything just to get their body moving. You should encourage that patient to just start off with 10 minutes a day and increase slowly. That is such a smaller bite to bite off than doing 150 minutes per week. And then also designating an exercise partner is recommended. So the fourth thing that you should know how to do as a type 2 diabetic is blood glucose testing. You can check your blood sugar with a blood sugar meter or have a continuous glucose monitor. Typical times to check their blood sugar is in the morning before eating or drinking, and that's usually called a fasting blood sugar, before a meal, 2 hours after a meal, and then at bedtime. the target for blood glucose and their treatment. So before a meal, the target for a blood glucose is between 80 and 130. And then 2 hours after a meal, the target is to be less than 180. Check your blood sugar and it's less than 70. You have symptoms such as shaking, sweating, nervousness, dizziness, or hunger. They should drink 4 ounces of fruit juice or some type of candy to get that blood sugar back up. And that's usually caused by too much insulin or diabetic medication, exercising more than normal, or even drinking alcohol. And then there's too high blood sugar, which is greater than 250. That's symptoms such as very tiredness, thirsty, blurry vision, needing to urinate more often, which are all signs and symptoms of type 2 diabetes, polyuria, polydipsia, polyphagia, and they need to check their blood sugar more often and probably notify their provider. Not only is checking your blood sugar important, but also checking a hemoglobin A1C level, which is a blood test measuring an individual's average blood sugar over the previous 3-month period. And the goal for most adults is between 7 and 8%. As you can see, the 7% is 154 of blood glucose and 8 is 183 blood glucose, which is a pretty good blood sugar. Additionally, managing illnesses with diabetes, usually type 2 diabetics, their blood sugars are a little all over the place when they're sick. So monitoring it more often is very important. Taking their medications as prescribed, drinking the calorie-free liquids, or at least 50 grams of carbs every 4 hours. They should weigh themselves and, of course, prevent dehydration. And the last skill that a type 2 diabetic should know about is how to prevent, of course, amputation and how to perform foot care. They should check their feet every day, check for sores, blisters, irritation, cuts. Nerve damage is very common in type 2 diabetics. It can lower their ability to feel pain, heat, and cold, which causes numbness and tingling of their feet. They should wear cotton socks and athletic shoes all the time when they're up on their feet. Healthy feet equals happy feet. So these are just some tidbits that we should tell our patients. Never go barefoot, washing their feet every day in warm, not hot water, trimming toenails straight across, don't remove corns or calluses, keeping blood flow, and wiggling the toes, things like that. Just very simple, but monitoring those feet. And when to schedule an appointment. Basically, anytime you see anything on the foot, they should schedule an appointment. But additionally, they should schedule it if they have recent loss of sense of touch or ability to feel heat or cold, pain in the legs, tingling, burning, dry, cracked skin on the feet, thickened yellow toenails, athlete's foot, a blister, sore, ulcer, anything on their feet, they should schedule an appointment. And so some endpoints. Like I've said, diabetes self-management education and can improve their hemoglobin A1C, blood pressure, cholesterol, and medication adherence. It can improve the patient's overall glycemic and metabolic control, and which prevents readmissions and improve quality of life. I hope you all have learned something during this presentation and can take note to hopefully improve the education you provide for your next type 2 diabetic patient. Thank you. Bye-bye.